So my name is Clara, and I am the CEO of Silicon Valley Council of Nonprofits. I'm here with our colleagues in San Mateo County at Thrive, and I wanted to tell you a little bit about why we're here and also why we're not here. So we're not here to give you a bunch of public health information about COVID-19. There are extremely good resources about COVID-19 on both the San Mateo County Public Health website and the Santa Clara County Public Health website. And I'm going to make sure that we keep repeating the information that is coming out of Santa Clara County so that you all know where to get that information and when it changes. On the Santa Clara County website, there's also information about the state's response to COVID-19, the federal government's response to COVID-19, and information and guidance for different types of organizations. There's a specific CBO document, there's information in multiple languages. All this stuff should be really helpful for you about what to do and what to understand how this virus is moving over the course of the crisis. The reason why we're here is because we wanted to make sure that we wanted to let you know that we are a touch point for you during this crisis when you need support. We're interested in making sure that people who need to get together and compare notes and coordinate are together. We want to make sure that you have updated examples from other nonprofits about how they are applying the public health information to your specific example. And we want to make sure that you're reassured that as nonprofits suffer losses for their revenue streams, they're confused and have challenges about technology, that we set up the resources that you need in that regard. So that's why we're here today, and wanted to thank you so much for attending this meeting and for joining us and for being interested in coordinating. And I want to introduce you to Georgia Farouk from Thrive, who's going to say a couple words as well.
Good morning, everyone. Again, my name is Georgia Farouk. I am Executive Director of Thrive, which is the Alliance of Nonprofits for San Mateo County. Thank you all for being here. And I wanted to thank our partners at Silicon Valley Council of Nonprofits. We have a monthly policy and advocacy call with them. And this last one was really overtaken by this idea that we needed to take action collectively on responding and preparing for what's to come with COVID-19. And so the idea was born that we would have a first virtual event and possibly ongoing virtual events to keep everyone in the loop and to also solicit feedback along the way and figure out ways that we can advocate for you all best. I wanted to echo Kira's words about the guidance for our respective counties. We also have a great website. The link is up there. Our county health officer, Scott Morrow, has been coming out with statements, and his main guidance really is around the fact that he has evidence that this is progressing rapidly and that we, in order to halt this, we do need to have all non-essential events come to a grinding halt. We know that is not fully possible in the nonprofit sector, and that's part of what we're talking about today and part of why we're featuring several nonprofits who are experiencing how they pivot in service delivery during this time. And so we will be hearing from them. A couple of housekeeping items before we get into that. So this webinar is being recorded, and the recording will be available to participants in case you want to share it with your colleagues. Please note, as you already have, that this is a bit new for us in terms of collaborating on this, so there will be some technical difficulties. I noticed that somebody's asking for the links. You'll receive the slide deck, which has all of the links for San Mateo County and for Santa Clara County as well. So we will be sending out the slide deck. Of managing this for many, but what we've also heard is that people want us to share this information broadly, so that's part of what we're doing today. So we have someone from Life Moves who will be speaking on that. And then we have two speakers on adapting nonprofit services and business models. We have someone from Sacred Heart Community Service, and then also someone from San Mateo County from Samaritan House. And then we're going to be going into talking about advocacy for nonprofit recovery. We know that the losses sustained by nonprofits will be significant. We don't know how significant yet. We're talking about some proactive measures that are being taken. Then we're going to be talking about intermediary support and coordination. We're going to be hearing from Wendy at Silicon Valley Council of Nonprofits, and Wendy Ho, and then Petra Silton with Thrive Alliance. And then we will have a little time for attendee input and polling. And then we'll be talking about next steps as well, as we foresee this to be ongoing. With that, I would love to transition now to our first nonprofit guest, who is Ann Jarchow, who is the Vice President of Human Resources at Life Moves, who again is going to be speaking with us about ensuring the safety and well-being of nonprofit staff.
Hi, everyone. This is Ann Jarchow. I am the VP.
Hold while we tee up our speaker. Thank you.
Sure. Can anyone hear me?
Hi, can anyone hear me? Oh, great. Okay. So this is Ann Jarchow. I'm the VP of Human Resources with Life Moves. I'm here with Jeff Gallipo, who's our Senior Manager of Talent Acquisition. And, you know, we're happy to share some of the things that we have been experiencing with staffing, as well as some of the contingency planning that we are putting into place. You know, currently we are, you know, have halted pretty much all of our meetings that involve more than 8 or 10 people. So we have expressly gone to Zoom meetings for any of our regular scheduled meetings or trainings, and have been being more flexible with our administrative staff, working from home as needed based on their manager discretion. In terms of staff contingency planning, we're looking at different staffing pools that we can draw from, because we know that staffing is going to probably be dropping off with people needing to care for children or sick family members, or people getting sick themselves. So we have pretty much re-upped all of our on-call staffing recruitment website posts, hoping that we can attract maybe some of the university students that are, you know, out of school now, or people on hospitality industry. We also have reached out to temp agencies and are looking at what resources there might be there. Based on the level of need, too, we are looking at our admin staff and higher level program staff being repurposed to sites as needed. And also corporate volunteers have been reaching out, asking how they can help, since they're all working from home and have time on their hands, and looking if possibly we can use them to help support our sites if we need to. More of a last resort for us would be, we're looking at potentially having more high functioning clients that we can use and bring on site to pay to be peer team assistants, helping run our shelter sites. So we've really identified what the minimum job duties are for our program contingency staff, and looking at all of these potential on-call pools to be that resource for those minimum job duties. Some few things we're thinking about in terms of benefits and sick time. We are allow staff to borrow up to 3 days of PTO. We're looking at doubling that. We're looking at potentially offering emergency PTO. We're looking at also increasing or helping support benefits from SDI or paid family leave, adding a little bit more to what someone might get for, if they need to apply for SDI or paid family leave. So these are all things we're considering. We haven't implemented them yet. We're also really focusing on mental health support too. We have our EAP has sent out a video that's been very helpful for folks who are stressed about the COVID virus, and we've sent that out to staff. We just implemented Headspace actually a couple weeks ago that we are really pushing for staff to use for mindfulness and meditation, and also really trying to keep our communication regular and informing staff, even if we don't have a lot to report, just letting them know we're working on things. We're going to be implementing biweekly manager calls too, to keep managers informed so that they can keep their teams informed. And operationally, working really closely with our operation teams on, visitor signage, Purell stations, keeping, them updated on posters that they should be putting around their sites, and really supporting them too with their specific site needs in terms of facilities and operations. So that's pretty much what we've been planning. Is anything, Jeff, you think we can add? Yeah, so we have had staff that feel that they could have been remotely exposed, so we have been allowing them to self-quarantine for the 2-week period. It hasn't been too widespread yet, but we know that will continue. It's been mostly our administrative staff who've been out in the community. So looking at ways that we can help with pay so people aren't using up all of their accrued PTO now. So, but that seems to be our biggest need right now from staff, and of course those that are needing to stay home with their kids from school. So that's about it on our end. We're happy to take any questions at the end of the call, but we will turn it over to the next speaker.
And I'd like to now introduce Poncho Guevara from Sacred Heart Community Service in San Jose. Poncho will be talking about how we can migrate our services, shift, pivot in this crisis time in a number of different ways, as well as how we can advocate for the communities we serve.
Thank you, Clara. Thank you for all the participants and your incredible work of trying to stand up and keep operations going during a really challenging time. The couple things I was going to try to bring up is looking at what really the community is facing right now and trying to anticipate some of the challenges. We've all are having to find ways of just making that decision between how we can just keep doing what we're normally doing, but also what are the additional needs and concerns that are happening in the larger community around the COVID-19 crisis. And as we've been working on anticipating some of those crises, we've been thinking about how we need to be able to stand up operations to be able to provide additional support for folks and look for different ways of being able to go doing that. One thing that we've been, many of you are participants in and are aware of the homelessness prevention system that we've been part of for the last few years, developing a pilot and growing out this effort. There are currently 15 organizations that are part of this network, and we've not only been looking at how we're going to be able to expand potential resources that would be able to flow to individuals that are affected by the crisis by providing additional financial assistance if as workplaces and hopefully not, but potentially schools that have low-income families shutting down. We've been getting prepared to be able to say, how are we going to be able to create a very efficient operation, utilizing technology, utilizing and building on the infrastructure of different partners, and trying to get folks the resources that they need to be able to pull this off. But that's required us to be able to take on an advocacy role, to be able to push our local jurisdictions to be able to not only provide perhaps upping assistance, and we've been in conversations with the city and the city of San Jose and the county on how they could actually increase that, but also for them to impact policy, meaning that having an eviction moratorium and looking at how we can be able to create a really effective and efficient process to be able to get that through. We've had some political leadership, and I know it's not only been San Jose, but other cities have been looking at how they could actually play a role in doing that. And this, at these moments of crisis, it calls on us to be able to lean hard in on our partners and say, this is a time where we need to do things a little bit differently. So alleviating some of the requirements for how we're doing what kind of data needs to be tracked in a normal situation. We're providing normal services and be able to advocate for that. And policymakers seem to be amenable to that, but that the devil's in the details and how we're able to do that. But then for us to be able to look at how do we drop some of the things that we normally do. My team has been in a space, we have been having meetings every morning to be able to do some COVID-19 kind of response team. The reason I joined the call a little bit late was our team was still finishing up, and we were looking at how are we completely reorganizing our food pantry operation and looking at how we're able to adapt that to do things like drive-through and creating some additional safety and other precautions that are there. Communicating with funders, we, like many of you, had a big event that had some fundraising implications for us, but our funders, we canceled a summit that we had planned for our members and staff, being able to do that, but communicating with those funders about, hey, we're not going to be able to do this event. It's something that you're a sponsor of. And also, so one, we're not going to meet that goal that you set for the current fiscal year, but two, we need you to roll in some additional resources so we could actually hire some temporary staff, because our volunteers have actually just evaporated. For an organization that relies on 100 to 200 volunteers a day, then to actually see us down to operating with somewhere around, anywhere between 20 and 50 volunteers a day has been pretty hard. But how do we readjust and make sure that we're able to still serve a lot of folks coming through, be able to develop safety protocols and provide some direction and assistance and education and safety kinds of resources for folks has required us to be able to think differently about this. But just like most of you, what we're facing right now is obviously staff that are deeply concerned, that want to be able to know exactly what's going on and what we're doing to protect them, but also staff and volunteers that want to know how we're standing up for our community and getting folks involved. So constant communication, giving people some resources to be able to know, like, again, just repeating the same types of emergency protocols that are there has been, really key to having folks feel safe and secure. And then also reassuring staff that we're going to be hiring some temporary personnel. We're going to be able to do some make sure that to make up for the lack of volunteers that are happening, and communicating with funders. That's been a big part of, I think, my job and a lot of many of your jobs over the last week or last few weeks, to be able to say, how are we going to get the resources to be able to weather this crisis, especially as folks have not been showing up. But one of the things I just wanted to bring up that's been really helpful in our communications with our staff has been looking at this moment, not as being a time of retrenchment, but as a time of what do we need to do to step up for our community, and how are we leveraging the infrastructure of our boards, our volunteers, our donors, and our partners to be able to make sure that we're actually able to meet the concrete needs that are coming up in our community right now. And so that means sometimes being able to, check in with staff, check in with partners, getting additional resources, training, getting different supplies from different partners and reaching out to that. But also looking at our sick leave policies, looking at what we're able to do to try to make sure that we're having. This may have been brought up earlier in the call, but being able to say, hey, if somebody's sick, you don't need a doctor's note now. We understood that, but we were doing that from day one. Let's just make sure that we're sending people home and making sure that they feel safe and secure. Folks we are unfortunately not in a position as an organization to have many folks, because we have a lot of most of our work is direct community facing. So there aren't a lot of opportunities that people have to work from home. But as we stand up a financial, service infrastructure or financial, assistance infrastructure, we're going to be piloting how individuals and families can remotely actually access some of these resources that are available, so that they get the financial support that they need and they don't lose their homes during this crisis. So, we're leaning on our partners, not only at Destination Home, but our technology consultants, and being able to look at how we're building out in our Salesforce system opportunities and protocols for folks to be able to access this resource through online application and through face-to-face, through phones, or through some other kind of communication mechanism, so we could actually get documentation that we need to provide assistance to people in a very quick and efficient way, especially for homebound seniors. The last thing that I'll mention is there are things like I had noted before, that we are working on an eviction moratorium in the city of San Jose that's coming back. They had a conversation about it on Tuesday night. They're coming back again this coming Tuesday with a policy that would be a temporary moratorium on this, and pushing for that, because we know that we're not going to be able to provide enough financial assistance to prevent everyone. We need to have additional policy protections. So we'd like to see that happen, and there are partners working with other cities in our region to try to make sure that those things are happening. We're also aware that there's potentially state legislation that might be able to, to subsume a lot of that work that's happening, but we can't guarantee that. So we are the organizations that are actually working, your organizations are the ones that are working in local communities throughout this region, and being able to communicate with council members that they need to follow the lead of what's happening in San Jose and Oakland. I know of other things, other types of initiatives that have happened, and we're trying to utilize some baselines. So our partnership with I want to give a shout out to the Law Foundation Silicon Valley, and their work in terms of working on developing some sample ordinance, policy stuff, and partners such as working partnerships that are helping to convene some other folks to not only do the eviction protection, but also look at what we're doing around sick leave, being able to have sick leave policies that would apply to these communities, and especially making sure that that is a requirement for employers to be able to have them, is really, really key. And this is an opportunity for us to highlight. I don't mean to be too opportunistic about this, but the fact that this kind of crisis is actually coming down on especially our low-income, our most vulnerable members of our community, where they don't have things like eviction, not only eviction protections, which we're working on for this crisis, but on an ongoing basis, what are we doing about sick leave, and making sure that individuals can actually take that time off, take care of loved ones, and be there. And it's not okay that the level, or only having a few days that are available for some classes of employees does create and foment a public health crisis. So it's really important for us to be thinking about that, looking at our own policies as organizations, and being flexible with those policies as our individuals. Literally, as I was walking into this particular meeting, I had one of my staff saying, "Hey, I've got one of my staff. He says he's sick. He's run out of all of his vacation, PTO, everything. What do I do?" I'm like, "Send him home. That's what we're doing. We're gonna pay it, because we just don't want to risk it. Not only to him, but to other people that are exposed to a variety of different things. He did not have any of the COVID-19 symptoms. It's a different kind of thing, but it doesn't matter at this point. And being able to kind of live with the consequences of being able to put that additional pressure on our staff. And so for us, we're going to do a couple of other things that are going to be helpful. Not only are we doing things that are different in terms of our staff training and infrastructure that we have on a weekly basis. So we're not going to be having our normal all staff meetings where we assemble our 73 staff together every Friday to do training, professional development, and planning efforts, but we're actually going to be breaking those teams up and being able to do some other things virtually, with sub-teams working on different groups, on different tasks, but also being able to find different ways of kind of deploying and keeping people's energy up and having consistent communication. So like myself and other senior management are going to chain meetings, talking with different teams, not only about what we need to do to try to make sure that people feel that they're aware that we're actually doing everything to try to safeguard our members, our volunteers, our staff, in terms of making sure that they're safe, but also reminding them of what our key role is in the community, and not to just feel overwhelmed by the fact that volunteers abandon us, and those with the privilege of health and health and ability and financial stability, that we don't go running away from this obligation. So we continue to call out folks in our community. We're still working with our organizing committees that are working on what's going to happen with undocumented communities and homeless individuals that don't have access to the adequate health care that needs to be that they need to be successful, and presenting information to them and deploying our promotores, our leaders, to be communicating with their community as well, and getting them involved in things like the eviction moratorium and perhaps some paid sick leave policies that local communities can be involved in. Our attitude, and not everyone has a privilege of being able to operate this way, is that this is the time where we show up for our community, and this is the time we invite our community to be involved in helping us show up for each other. And so, we feel really grateful for our partners in all the networks, both the Rapid Response Network that's working on keeping our operations open for a 24-hour hotline around ICE detentions, because there's still ICE is still doing courthouse raids and or courthouse deportation things, but keeping everyone up and focused on the work that needs to happen there, and people's energy up there, because that could be really demoralizing with this crisis on top of that. Our homelessness prevention system partners, and including our emergency assistance network, partners that are core elements of that team, and just be in constant communication and rolling out new protocols and securing new resources. So, big thanks to the city, to Destination Home, to the County of Santa Clara, to SVCN, to all of our partners that are working in a variety of different ways of being able to do this, and the flexibility that we've seen from Second Harvest and our variety of funders that are saying, we're here to roll with you. We're not going to penalize you for not achieving some of your goals, or collecting some of the data that you normally would be collecting over this period of time. And let's figure out how we're able to do this thing and change operations to be as efficient and as transparent as we can with everyone throughout the process. So that's kind of what we're looking at now. I don't know if there are anything else you wanted me to cover, Kira, but again, take the time, listen to your folks, listen to your staff, take care of yourselves during this crisis. Your self-care and your roles in your organizations is really, really critical. And take a look at your own policies. Take a look at what you're doing for your staff around sick leave, and as flexible as you can be. I have faith and hope that we can push collectively as networks to try to see if it's money, it feels like, we can't afford to grant additional sick leave to staff that are feeling vulnerable, or actually are impacted directly by COVID, or have these other types of things. We'll try to push collectively to get the resources to actually compensate us at the back end of this. But it does remind us, and it was a little bit of a slap in the face, I think, to everyone. There's some cold water in the face to all of us about, why reserves are really important, and how hard it is to build those up. So if there are any questions, I'm happy to be able to answer those. But again, thank you and congratulations to everyone for holding firm and doing what you can.
Okay, thank you so much, Pancho. That was really extraordinarily helpful. And I'm sure we'll have follow-up questions. I wanted to take a moment to introduce our next speaker, who is Latrice Taylor, who is the Associate Director of Programs and Services at Samaritan House in San Mateo County, who will be speaking on a similar topic around adapting their nonprofit service model. And just hold for a moment while we get Latrice. All right, Latrice.
Good morning. Can you hear me? Can you hear me? Okay, great. I'm so sorry there's no video, but at least as long as you can hear me, that's great. Yes, I'm Latrice Taylor from Samaritan House in San Mateo County. Thank you so much for the opportunity to speak today. And a lot of what Pancho already said is what we are also looking at as far as our business practices and processes with regards to helping the clients here in San Mateo County. a lot of what he's already said I don't want to repeat. So yes, there has been the challenge of how do you continue to serve clients as well as how do you continue to engage volunteers? Because in these times of crisis, when there is the unknown, people don't know what to do next. So what we try to do is put out as much information as is possible. Of course, we're following all the protocols, and we're trying to be in contact with the health departments and with other agencies to see what they're doing in adapting to this situation. Because for us, we're looking at 90 staff, but we're relying on nearly 4,000 volunteers. And already we're seeing that volunteers are not showing up, not coming in, and that's greatly impacting how we serve our clients. So what did that mean right off the bat? We had to quickly adapt to think which of our services are the most needed. For instance, we have two programs. One is Kids Closet, which is staffed by our volunteers, and also we have Food Pantry, which we impact, I believe, nearly 14,000 individuals with hot and cold meals, their groceries, after-school program meals, senior meals, home delivery. We had to then say, what should we be doing instead? And so what is the most pressing is food. We've decided instead, let's close Kids Closet and maybe we can switch our volunteers over into the Food Pantry and utilize what volunteers are showing up on a regular basis. We're trying to get information out to our whole volunteer base, but whether it's the individual or the corporate volunteers, and letting them know that this is how we're responding to the situation. This is how we could use you. This is what we're doing and putting in place so that we're minimizing any risk to you. So for instance, in our food pantry, because we know clients usually would come in and shop, instead we said, you know what, we need to switch this quickly and minimize risk. So that means we pack up everything individually. It used to be you could shop for your fruits and vegetables. Well, now everything is individually packed. And now it is less time for a client coming through, where instead the staff or a volunteer can just hand them the items that they have signed up for, and then that minimizes their risk. And we're seeing this as a way of telling volunteers, if you don't want to be interactive and personally face-to-face with clients, we need you on the front end. We need you to help bag and pack all these things individually, so that could help them still want to be able to come in and help, but not feel like they're putting themselves at risk. We rely on a lot of seniors, so we are being very sympathetic to the idea of they're not going to necessarily come in, but wherever volunteers feel like they can be used, we want to minimize their risk of exposure. We also have a tax site where we've been doing great with helping with free tax preparation. Well, now we're going to have to reconfigure what that area looks like. It used to be in our conference room, but now we're going to have to go to individual offices so that we can, again, reduce risk of people being in confined spaces and being up close. So we're just trying to think, what is it that we still want to provide the service, but how do you minimize the contact so that protocols that are suggested can be put into place? With advocacy, this county is very big on partnerships and relationships among each other. And so what we try to do is put out as much information as is possible. We've been very good in emailing our mayors and our board of supervisors and our funders and saying, this is what is going on in your community. We know that we've had to cancel our own main event, which is a big fundraiser for us. But then we're trying to say back to our politicians and our funders, okay, this is not going to be the normal that we've had in years past. So this is what we're seeing as a need moving forward, and help us to come together and strategize on how can we continue to fund programs, knowing that more people are going to be driven into our agencies needing help with financial assistance, which we help with food. What is it going to take? And if our funders can be informed and educated about those things, then I think they'll rise to the occasion. One great thing is our San Mateo County's Human Service Agency is very proactive in reaching out to agencies that they contract with and saying, hey, what is going on? What are your needs? And can you give us some ideas around funding? So we've already been contacted by the county and being asked, and not just us, but other agencies in this county, because again, we have a very strong partnership in figuring out how do we continue to serve the residents of San Mateo County. So it's ongoing conversation, it's being flexible, and it's just being consistent in getting out the word and putting out facts and truth so that residents can see that if we're not panicking, they shouldn't be panicking. If they have a need, they should feel like all I need to do is call into this organization and they'll give me guidance, and they'll have a trust that we're not putting our clients at risk, but we still want to serve them. We, as I said previously, we do financial assistance. So that may mean looking at how do we assess cases differently. Does that mean that instead people call in and do phone calls and be assessed over the phone? Can they fax in their information? Can they mail in their information? Can they just, nearly everyone has a cell phone, so that means take a picture and forward that picture of their documents that would support a financial assistance case. Those are things that we're taking under consideration, because we have to use our technology to the best of our abilities so that ultimately we can continue to serve our clients. But that's just a short snippet of where we are and what we're trying to do as far as meeting the need. And we will continue to be flexible and work on what is the next challenge that comes to us. And we just know how to keep talking and keep up the relationship going so that we know we're supporting the residents in this county. And if there are any questions, I'm available to that as well. Thank you.
Thank you so much, Latrice. It's Kira Kazantzis again, and Georgia and I are going to talk to you a little bit about the advocacy work that we're doing on behalf of nonprofits in our community in the context of this crisis. So I think, it's suffice it to say that SVCN and Thrive have really shifted into high gear, both on the coordination front and the advocacy front. Wendy and Petra are going to say some more about coordination, but I do want to point out that we are communicating with the county multiple times daily, both to make sure our nonprofits have the information that they need, and also to advocate about good lines of communication and how nonprofits are kind of included and their input is regarded, and also how they are treated as partners during the process of this, responding to this crisis. So I want to talk specifically about advocacy with county contracts. So we are collecting right now input from you all about what we should be asking the county for, and top of our list is to ask for fee-for-service contracts to be converted to cost reimbursement contracts, so that nonprofits' sustainability is preserved during this crisis. Obviously, a number of nonprofit agencies are seeing their clients or participants fearful and stop coming to meetings, or even not showing up to phone conferences because they are not used to using the technology, or because they are fearful, or it's not a usual way of communicating. And so we're having folks who would normally be seeing several clients a day not seeing anyone. And if the county insists on us sticking to their traditional deliverable model and their fee-for-service model, nonprofits are going to start seeing a lot of losses in billing. There's other rules that the county has about, for example, certified mental health sites that may cause reimbursements to be dinged if phone call meetings are happening instead of meetings at sites. There's now, as of yesterday, some modeling by the city of and county of San Francisco around how they'll be treating their community agency partners with respect to contracting. So we will be looking at that list of changes that the city and county of San Francisco are taking and adding those things, if applicable, to our list of requests and demands to the county. This is a good time for county contractors to tell us what they would like us to ask the county for. We've already signaled a number of very important requests to the county about flexibility, and where we will be in the next, I would say, couple days making a formal demand to the county. So please, in the comments or in emails to me or to Wendy Ho, send us your ideas for that request. Obviously, in terms of advocacy, we'll need you like we always do. So when we ask you to send a follow-up email or calling your supervisor or the county executive's office, we'll be asking that just like we always do. Say something about the city of San Jose. I understand they've been directed at the city manager's level to create a recovery framework that has to do with financial recovery. And they have incorporated now, at our request, in the small business recovery framework, nonprofits as well. So we will be giving our feedback to their recovery framework, and I have already made a number of requests about how that might look. Again, your input is really needed. So please, thinking about, for sure, arts organizations, I think will be, their needs will be addressed by the city of San Jose. Other partners, the best contractors, the CDBG contractors, and then just nonprofits as a whole, who are doing all kinds of different work in conjunction with San Jose as businesses. We will be asking them for some fund and technical assistance and other things as well. We are actively communicating with a number of foundations about how they can support. The primary communication we're having, quite obviously, is the Community Foundation. We have made a direct request to the Community Foundation to convert all of the grants that they currently give to operating grants. We are certainly bottom lining that in terms of deliverables, so that any deliverables that they end up insisting on should be flexible and generous. And also, we have weighed in on how their fund should look. So on a macro level, but also with respect to how they should support nonprofits in terms of covering nonprofit losses. And we've given a number of different examples about how they could cover nonprofit losses. We understand from our partners up at Cal Nonprofits that they will be seeking state legislation for a relaxation of all state contract deliverables. And I think it probably also makes sense to talk to the governor's office about executive orders, and we will be weighing in on that from a local perspective. There are also conversations being had with our local delegation about federal legislation. We see that our partners at the national level, the National Council of Nonprofits, just sent dozens of very large national nonprofits has sent a formal letter to Congress to ask for a number of different things, including flexibility with federal grants and federal contracts. I'd like Georgia to say something about the advocacy that Thrive is doing, but I think the bottom line with this approach is that we need your input, and we're going to need your support when we're out there advocating.
Hi, everyone. Again, Georgia Farouk with Thrive, and we are doing many of those things in parallel with Silicon Valley Council of Nonprofits. I just wanted to mention that we've been in close touch with the county manager's office, and in particular, I just wanted to say that the county has been very proactive in working with the CBO community already to identify what the needs are during the virus. So Peggy Jensen, who is Deputy County Manager, has been working with the CBO contract group already. And we are also soliciting feedback on ways that we can communicate to the county what your needs are. And we've already received feedback. We have specific requests around food distribution and exemptions around food distribution for large gatherings. Those are the kinds of things that our nonprofits are asking the county to advise on. Are there exceptions around, large gatherings when it comes to food distribution? What is the protocol when someone from a team that is involved in direct services is found to be positive with coronavirus? What is the specific protocol around the timeline for not being able to deliver services, and what does that look like? So those are the kinds of things we are in communication with the county about. So some on the health front, some on the contracts front. I wanted to reiterate that Jan Masaka, who is the CEO of Cal Nonprofits, has specifically asked for us and all of you to provide input around government contracts and foundation work that will not get done due to the virus. So an example is preschools, nonprofit preschools that are, run through reimbursements. And is there a way that we can work with government so that contracts can still be paid, so that staff does not need to be let go, but that they could make the right decision to close schools when necessary? So these are the kinds of things that we want advocacy on, and we want to participate with you on. And then finally, Clara mentioned that we will be conducting a Survey Monkey that really tries to start to track what these nonprofit losses are, so we can think about recovery as well. And I'd like to pass it on now to Wendy to talk a little bit about Wendy Ho of SVCN and Petra Silton of Thrive are going to talk about intermediary support and coordination, and then we will have time for your input.
So good morning, everyone. I just want to thank all of you for being with us this morning. We apologize for the technical difficulties we've had this morning, and we want to, again, reiterate our patience. If you have questions about anything you heard or requests that you have of either SVCN or Thrive, please communicate that via the chat box option. So a couple of things that we wanted to bring up. One, Thrive and SVCN are really just here to be conduits of information with our local county and city governments, with funders about the needs we have in the wake of COVID-19. And earlier in the slide deck for organizations that serve Santa Clara County, and in the meeting invitation you received today, there was a link for a very short Google form. We're requesting organizations that serve Santa Clara County to provide contact information for lead staff. We will then funnel that information at the request of the Santa Clara County Emergency Operations Center, so that they can also distribute relevant information to the sector. Again, we just want to make sure that we are responsive to the needs of the sector. We don't want to get in anyone's way. We're just here to provide that conduit of information between the nonprofit sector and our city and county and private funders. To that end, we are launching a couple of initiatives to help facilitate some of that communication between entities. One, we will be launching a Google Groups listserv with Thrive. It will be an email list for rapid response and information sharing. We will also be developing a webpage with a lot of the resources that you heard about today, samples from nonprofits on decision trees and sample policies that changes that they're making to really address some of the realities we're facing under COVID-19. And so we will be launching that website very soon. That website will also include a recording of today's webinar. SVCN and Thrive are also very much committed to convening as needed for coordination purposes within the sector. That's what the bread and butter of our organizations are here to do. And so we will want to continue to be a resource for you. And speaking of resources, if we can get to the next slide. Some of the inquiries we've gotten from our nonprofit members are around resources for teleworking. And again, all of these links will be emailed to participants after this call. For those of you who are not familiar, TechSoup is offering a discount for Zoom subscriptions up to 50% off. And for those of you who are not familiar with TechSoup, it is it's an organization that supports nonprofits by providing access to donations and discounts on software, hardware, and services from a number of major tech brands. It is free to join. And if you're interested in accessing the discounted rate for Zoom teleconferencing subscription, there is an administrative fee of $65 for TechSoup, but then you get the Zoom Meeting Pro subscription for half off, for $75 billed on an annual basis. For those of you who are Google Suite or G Suite subscribers, Google just announced this week that they are giving free access to advanced enterprise suite of technology they have. This includes free access to advanced Hangouts meeting video conferencing capabilities through July 1st. So that includes Google Hangouts to accommodate larger meetings for up to 250 participants per call. There will be a live streaming option for up to 100,000 viewers within a particular domain, and the ability to record meetings and save them to Google Drive. Also this week, we learned that Dropbox is offering free Dropbox business subscriptions for a 3-month period to nonprofits that are focused on fighting COVID-19. Organizations that are working to stop the virus or providing relief are encouraged to apply. And again, we'll send you the link by which you can apply for that free 3 months of Dropbox business. And then we also just learned this morning, Comcast. This might be of interest for folks who provide services to low-income residents who may be forced to telework. They are offering new customers of their Internet Essentials program, which is their program for low-income residents for high-speed internet. For new customers, you get Internet Essentials free for 2 months. And then for those existing customers, you'll also receive a bump in the speed, the speed that you'll be able to get starting Monday. So that's very exciting, and we're grateful for our partners in the tech community to step up. And with that, I want to turn it over to my colleague Petra Silton with Thrive.
Hi, everyone. I just want to reiterate what Wendy said, that really Thrive and SVCN are here to support your work in a multitude of different ways. But one of the things I wanted to talk about specifically was offering some resources. We know a lot of you had to cancel big fundraising events. So we'd like, on the website that we're working on together, we'll have different examples of what people have been doing. There's been some great examples of people who have turned them into virtual parties, people who are postponing, what kind of language they're using, stuff like that, that I think would be very useful for people as they're going forward. I know most people have canceled anything up till the end of March, but I think we should be prepared for people who need to cancel going forward as well. Another thing that we will be able to put on the website is there have been several organizations who have offered free services for nonprofits that we would like you to be aware of. We have one organization that's offering free consulting about financial issues. As Pancho mentioned, cash reserves and how we're dealing with all of that is going to be a big issue for many people. They also work with risk management and how to kind of map out your budget. So we will have that as an option. We also have another organization that's offering free consulting on leadership and how to deal with things in crisis, which I think this qualifies as. And the other thing I wanted to talk about briefly was that everybody is having to pivot on how we have meetings and how we kind of get the word out. And I just want to briefly bring up census, because I think it's really important. Right now, everybody's just kind of in crisis mode, but we can't forget what we need to do on census. And many of the grantees who've been working on census have been planning big, this is exactly the time. We got our census in the mail yesterday. We really need to help and support the organizations to be able to do other things than what they were planning on, because there are not going to be the big parties and the big street festivals and all of the things that were being planned. But census is long-term. It's something we need to continue to be able to do. So we will also be posting resources. Our census office is creating things like lawn signs, door hangers, and a lot more kind of social media. And we're all going to have to step up the way we do that and pivot again on the plan. So we will be leaving as much information as possible on our website about that. Okay, now we're going to move back to the attendee input. Okay, Wendy's working on pulling it up. We've got a couple of people who are going to talk, and then we're also going to do, oh look, the United Way appreciated that we called out census. So yes, don't forget about census. You can still wear your t-shirts, just whenever you have a video call, wear your census t-shirt. Kira's in here right now wearing her census t-shirt.
Okay, so thanks everyone again for your patience. Before we turn it over to you all for questions and comments, we wanted to do a couple of quick polls with you to just kind of gauge interest on meetings and kind of where each of you are at. And with that, you'll have about 20 seconds to respond. So I'm going to launch the first poll question related to whether or not you all would be interested in attending a future briefing by your respective county leadership. And not surprisingly, looks like most of you are interested in it, and others maybe not as confident about that. Okay, we'll give folks another few seconds. All right, I think we're good. And not surprisingly, folks are interested in attending in a future briefing with our county leadership. We will see if we can get something like that scheduled in the very near future. Perfect. Okay. And let's see. Oh, let me try get to the next question. Sorry. Technical difficulties yet again. Okay. Next question. We recognize many of you have canceled or postponed a major fundraising event. We just want to get a sense of scale as to how many of you have had to do that in response to COVID-19. Okay, it looks like we're about half right now. That's very interesting that about half of you have had to cancel or postpone. About the other half, no. Okay, let's do one more question on some of the technical support needs that you may have that SVCN and Thrive might be able to help with. Then maybe they don't have a cloud file sharing service. Great. This is very fascinating feedback. For those of you who have indicated other, if you could put in the chat box what those tech needs are that weren't covered by the aforementioned options, that will be very helpful to us. So thank you all for that very quick feedback. Now we're gonna hear from a couple of our attendees. And first I would like to turn it over to Dr. Anna Valdez with Health Right 360, who's leading that agency's efforts around COVID-19. Dr. Valdez, I've gone ahead and unmuted your line, so if you can go ahead and take the mic, we would love to hear about some of the things that you've been doing at Health Right 360.
Thanks. Can you all hear me? Can you all hear me?
Yes.
Okay, great. So Health Right 360 is a pretty large organization that's in several counties in the state. And so it's been a pretty big effort for us. We're a big organization, so have a few more, I think, resources to marshal than some of our smaller colleagues and nonprofits. But basically, we have really ramped things up from the beginning when we started thinking about this to pull things together to start addressing the fact that it could potentially get worse. And so we have a task force that meets twice a week that includes executive staff with representation from behavioral health, medical, and our various program areas, as well as administrative support in our health and safety. I am the lead of that, so I actually track all of your county guidances. So thank you very much for sending those out and having them on your site, because I track all of that and try to aggregate that across our whole organization so that we have a unified standard, but are also meeting county specific needs as well. And I put out regular memos once or twice a week with updates, as well as have put together some decision tree guidances. I had originally put everything in one kind of big guidance, but I think the problem with that is it was just a lot of information for folks to absorb, especially early on in this event. So I have started breaking them out, and I have very program specific guidance in each area. So I have guidance for our behavioral health or congregate living spaces, our outpatient behavioral health, our medical, which is different, et cetera. And are continually updating those based on CDC guidelines and updates as well. So I think, you know, it's been a pretty big lift, and a lot of things have had to be put on hold in order to address this. And so I think and some of the speakers spoke to this as well, prioritizing when there's a lot of other things going on. And especially, I think the thing that we are seeing the most of is a lot of panic from both clients and staff. So I recommend getting communication out regularly and often. And as the first speaker mentioned, even if it's to say we're working on these items and you'll be seeing them this week or something like that, just so the staff know that something is going on, and the clients as well. Otherwise, you know, as far as they're concerned, we're not really addressing it, even though we have a big effort. And to prioritize what those issues are. I'd also recommend that if you think about it, start planning it now. I remember a month ago, we started thinking, hey, they might close down the schools, and what happens if we have to close down a program? And we did not, I think, respond quickly enough. And now the schools are closed down and we're having to scramble to come up with a plan, as well as staffing contingency plans and things like that. So I think if you think it, start planning for it. If it doesn't happen, then great. But if it does, at least you'll be ready and won't be scrambling. And as I mentioned, you know, we're pretty large and across a lot of counties. So I rely a lot on the county guidelines as well as the CDC so that we're not reinventing the wheel, because we don't have to do it. We're far enough along into what is now this pandemic that there's a lot of guidance out there. And so I think a lot of it is having to take that and make sure it fits for your community, your clients, your services, and what you're doing. Those are our key points, I would say. I would say the other thing I'd say is it takes a team. It really does, but you need to have team members from all areas, not just a single area. There's a lot of information coming in, and I'm constantly in COVID meetings or getting emails from the staff, but I really appreciate it because there could be something that I'm missing or I'm not hearing about. And so it really kind of takes a team to address this, and thinking of ways outside the box to address some of the issues that are coming up. For example, with the school closures, you know, one of the ideas I had, which I don't know if is doable, but I think we should think about is, do we need to offer childcare on site so people can come to work? What are the risks of that? What are the benefits of that? Obviously, they can't be in client areas, so maybe that's not something that's doable, but those kinds of brainstormings with a group of people that are representing different areas like risk mitigation, compliance, HR, et cetera, is really helpful to find ways to kind of address this. And it's a new thing for all of us. So I think just being open to whatever ideas are out there and then, you know, trying to institute the best ones we can.
Great, thank you, Dr. Valdez. And as we queue up some of the other attendees who've wanted to provide some input, if there are questions you have or resources that would be helpful or suggestions on things that SVCN and Thrive can help support you and your organization and your clients in, please feel free to send us a message via the chat box. You can either send it to everyone who is on the line, or you can send that message privately to either SVCN or Petra Silton. All right, and with that, I'm going to unmute Bruno's line from Second Harvest, and he's going to share some of what Second has been planning and thinking around how to address some of the food access challenges in the wake of COVID-19. Bruno?
Yeah, thank you. This is Bruno, Second Harvest. First, I want to make sure people understand that providing food to food insecure people is an essential service and not something that can be shut down in the context of COVID-19. Just to make sure people understand the magnitude of what we are talking about, Second Harvest is working at the center of a network of 300 partners manning 500 grocery distributions and 120 congregate meal sites. Combination of those are serving 85,000 households on a monthly basis. That's roughly 285,000 individuals, senior and children that are counting on this food to come on a regular basis to ensure that they have enough food at home. And you heard two of our partners this morning through Latrice and Pancho were providing a fantastic service on the ground for that. One of the particular nature of our service is its physical nature. We cannot do that remotely. We have to exchange goods from one hand to another. And that's obviously a particular constraint in this context. All of our sites and partners, and Pancho and Latrice have described some of that earlier, have been implementing the guidelines of the various public health organizations. That was the immediate action that was done, and that's perfect. We think we need to go further than that, and what we're actually about to roll out starting next week is that all the foods provided to sites will be actually pre-boxed or pre-bagged That's the way we're going to distribute the food. The idea is that we minimize time and contacts at time of distribution. That's for all of our what we call just-in-time distribution that typically happen on a parking lot of a school or of a church or something like that. For our partners, because we know they have the same kind of requirement, and I think Pancho alluded to that earlier, we are working on providing to them supplies, so bags, boxes, and so on. One of the issue, obviously, that you recognize already is that everybody is running for the same kind of supplies. So that's only not an easy feat to do that, but we're working on that to ensure that we add that. We're also trying to source to-go meal package for our meal program. That's another thing we're trying to do. What do we need? The first thing is we try to do everything we can to keep our current site open. People are accustomed to go there. This is close to their home and so on. So that's our number one. It is not always feasible. We have already 20 sites of various natures that have told us they require closure and don't want us to do food distributions. And we are certainly anxiously looking at what happened with schools and if they do indeed close in the vast majority of them across the 2 counties. So Georgia was explaining earlier the work with the county. This is really, really important for us, is the county's health department making it clear that food distribution is a critical and essential service, and therefore they have some kind of waiver or something that allow flexibility for that, knowing that we all apply the sensible activities to ensure safety of everyone involved. That's the number one thing. We haven't been able to get a very forceful statement from them, both counties, on this part. Other one is obviously volunteers. You all know we work with a very large number of volunteers. Fortunately, the new model that we are going to roll out will most likely reduce the need of volunteers at distribution. We haven't sized that yet, but in the back end, we will need volunteers and workforce to actually build those boxes and packages before they go on the truck to the sites. We're working on that. Actually, the Second Harvest organization has decided to hire temps, and that's what we're currently working on to do. And then we're ready for the next step, which is, or getting ready for the next step, which is that if we have a large number of closures and if we see, as we expect, a large increase in demand, we have to expect that small businesses are going to be impacted, will close. We have to expect that hourly workers will be most likely the first impacted by this economic situation. And therefore, we're preparing for identifying and potentially launching what we call pop-up distributions, like we did during the government shutdown. These are sites which are not usual sites where we can handle people who are not necessarily coming to food distribution on a regular basis. That's something that we are planning for. It's not rolled out yet.
Yeah, people are already saying.
And that's it, what I wanted to say.
Thank you, Bruno, for that update from Second Harvest. I'm going to turn it back over to SVC and CEO, Clara Kazantzis.
Some breaking news, although some folks have already mentioned it on the chat box.
Yeah, folks, I just wanted to make sure that you knew that we are going to end exactly at 11:30, or let's say 11:29. So we have a couple other people we'd love to get on the attendee input line here, but I wanted to let you know that the County of Santa Clara is going to have a press conference at 11:30. You can watch it live on Facebook, on their Facebook page. It is expected that it will relate to schools, and I'm sure there will be other updated guidance and updated orders. So please tune into that. That's your best source of information. We'll spend the next 4 minutes with a couple other attendees. Continue your comments. We're recording all of this. We'll put it up. And oh, we're a little ahead. Okay, actually, apparently our clocks are set ahead, which is always good for me. Some people, I think, who are watching this are laughing. And now I'm going to hand it back over to Wendy so she can call on a couple more of our attendees.
All right, and with that, I'm going to turn it over to David Lowe with Destination Home to discuss their efforts around homelessness in the context of COVID-19. David, I've unmuted your line, so take it away.
Great, thanks, Wendy. And hi, everybody. Again, my name is David Lowe. I'm with Destination Home. And, I know Sacred Heart, Friends of Sacred Heart talked a little earlier about the homelessness prevention efforts we're making. But we've also been working with our public partners, and namely the City of San Jose and the County of Santa Clara, to make sure that their emergency response is also addressing our vulnerable neighbors that are on the streets, who we know may be have a harder time practicing some preventative actions that are necessary to avoid contracting COVID, or as well maybe a greater risk because they're generally less strong health if they were to contract the disease. So, we've really been trying to, over the past week, stay in touch with them. We've been invited to some conversations as the city and county have kind of taken a joint effort, and happy to say that, there have been some steps taken to make sure that personal hygiene supplies are more readily available, both to teams that are going out, outreach teams, as well as in our shelters, updating some of the protocols for the various folks who are serving people who are unhoused right now, whether it's mobile healthcare teams, outreach workers, people working in shelters, and then most importantly, really starting to explore whether there are additional sites that are available that be used for more temporary housing, particularly for those who may need to be isolated or quarantined, because we know those environments aren't readily available in our shelters. So, really this is obviously a very formal response led by the city and county partners in conjunction with the public health. But at Destination Home, we've just tried to stay engaged so that we can help support them, so we can make sure we're relaying the concerns that we're hearing from our partners on the ground, and then also seeing how we can leverage kind of our own fundraising networks and some of our corporate partners that we've brought along in our work to make sure supplies, resources, et cetera, are available to supplement this effort. So because of time, I'm going to go ahead and stop there, and thank for the opportunity to kind of share what we've been up to.
Thank you so much, David, for that feedback. We certainly appreciate your efforts. And to close things out today, we have Marcia Hovey with Cadre, and she'll talk specifically about Cadre's emergency preparedness and disaster relief efforts. And I will go ahead and unmute you, Marcia. So take it away.
Hi, thank you. So I've been on part of this call and part not, just because it was difficult to log in. So I'm sorry if I repeat anything that any of my other colleagues have said. But so Cadre is there. First of all, we're going to do a networking meeting on Monday, a phone call at 10 a.m. If anyone on this call wants to be part of that, we'll be sharing who's doing what and what the challenges are, just like this one. If you want to be on that call, email us at cadreeoc, CADREEOC @gmail.com, and then we'll send you the invitation, which is just going to go out in a little while. We're still working through our function team leads, which is Bruno is for food and feeding, Sherry Burns from the Silicon Valley Independent Living Center for Access and Functional Needs, the Red Cross for Mass Care, the Center for Living with Dying for Emotional and Spiritual Care, Immigrant Support, and I never remember them all. It's horrible. But they're pushing information out to their contacts, and then we're working really closely with City of San Jose and the county and public health to verify information and try to get some of these questions answered that I'm hearing on this call. We're going to keep pushing for that. But still, just trying to confirm, it sounds like the greatest need from our response perspective is the housing the sick, because they want to isolate them from their houses, and they're trying to work on that. And I know that they're working with other organizations on that. And then the food. And we are working with Bruno to see if we can't maybe involve the CERT program in some of this assistance, but we're still talking about it. And I think that's all. I'll just leave it at that. Hope you can be on the call on Monday.
Great. Thank you so much, Marcia, for that update. And we'll be sure to, again, circulate information about that meeting to folks who are on this call this morning. We will, as part of some of the resources that we will be sharing with you, we will get out a recording of this webinar. We'll include links to join our Google group listserv so we can dispatch out information in a very timely fashion. We'll also hopefully have a URL ready for our new COVID-19 resource page that SVCN and Thrive have been working on very diligently. We'll also send out links about some of those tech resources and discounts, as well as, again, a call for organizations that serve here in Santa Clara County, contact information that we will then dispatch to our county operations or emergency operations center. Again, if you have any last comments, questions, or suggestions, please send them via the chat box. We do want to be respectful and close this meeting on time so that we can watch that press conference at 11:30. And with that, thank you everyone for joining us this morning. We hope that you found today's webinar helpful. Again, our apologies for some of the technical difficulties we experienced early, but again, we are kind of learning as we're going and want to be as much of a service to all of our nonprofit members. With that, thank you everyone, and in touch. Take care.